Hello, my name is Nikki. I'm going to be doing your assessment today. I'm your nurse practitioner. My understanding is that we went through your medical history prior, so we don't have to go through that again. All right, so I'm doing a head-to-toe assessment. It's just a general physical exam, so I'm literally going to be going from top to bottom, inspecting, be listening. I'm going to be palpating or touching different parts of your body as we go, okay? If at any point anything feels uncomfortable, please let me know. If it's painful, please let me know. Do you have any questions before I get started?
Nope.
All right, great. So I'm just going to take a look at your head here. Just take a look up at me, please. All right, great. Sorry, your exam table is a little bit lower than usual. So the first thing I'm going to do, I'm going to just grab my pen light here, and I want you to follow the pen as I move it, okay? Great, bring it around. All right, great job. Now I'm going to shine my light in each eye, okay? So just keep focusing on the light. All right. Awesome, great job. So I'm now going to have you squeeze your eyes shut, and I'm going to try to open them, but try to keep them closed as best as possible. Good job. All right, you can just relax your eyes, keep them open. I'm just going to take a look at your lids. All right. Great job. And now I'm going to grab what is called a fundoscope, and I'm just going to be looking at the back structures of your inner eye. So the light will be shining. I'm just going to dim the light here. All right, you just look straight ahead at me. And then look to the left, look to the right. All right, so I'm just going to go and do the same thing on your left eye. So look straight ahead, left, look right. All right, great job. I can get my light out of your eye now, okay? So now I'm gonna just take a peek at your mouth and your jaw. Can you open your mouth and say, ah?
Ah.
Move your tongue up and down, side to side. All right, great job. Can you smile for me? Frown, puff your cheeks, clench your teeth. All right, great job. Next, I'm just going to take a peek at your ears, okay? So I have several different tests I'm gonna do. I have a tuning fork, I'm gonna do a whisper test, and I'm just gonna take a look inside your ear, okay? I'm just gonna take a peek at the outsides of your ear here. Inside. Great, looks great. I'm gonna grab my otoscope, and I'm just going to take a look in, so I'm just gonna pull on your ear a little bit, just looking at the inside. Awesome, I'm gonna go on the other side now. Feeling it pull. Is that painful though? All right, great job. All right, the next thing I'm going to do is called a whisper test. So I'm going to go behind you on both sides, and I'm going to whisper a word, and I just want you to tell me what you hear, okay? If you hear it.
Kangaroo.
I'm going to go to the other side.
Watermelon.
All right, great job. I know. And there's no rhyme or reason as to what words we pick. So the next thing I'm going to do is a few tests with my tuning fork, okay? So I'm going to tap my tuning fork for the first test, and I'm just going to place it on your forehead. I want you to tell me where you hear or feel sounds or vibrations, okay?
Feel them everywhere.
Feel them everywhere?
Yep.
You hear it too?
Yep.
All right, great. The next portion of the tuning fork test, I'm just going to go on either side of you, behind your ear, kind of like around your jaw, and then I'm going to do the same thing. We're going to tap it, place it on that spot, and I want you to tell me when you hear something, and then tell me when you don't hear it anymore, okay?
Okay.
You hear it?
I hear it.
Okay.
I stop.
All right. Okay.
I hear it.
All right.
I stop.
All right. Great job. Alrighty. Next, I'm going to move along and just take a look at your neck here, so you can sit straight up for me. Checking to see that your trachea is nice and centered. So have you turn to the side.
Which way?
Left to right. All right, to the other side, just look up and down. All right, great. And I want you to shrug your shoulders for me. All right, now relax them, and then I want you to shrug them against resistance. All right, great job. Now I'm just gonna palpate your lymph nodes. So there's lymph nodes kind of all over your neck and around your head, okay? We've got your preauricle, got your postauricle, your occipital. Sorry, this might feel like a massage actually. got your tonsillar nodes, kind of in here. You've got your submandibular nodes. And I can sort of feel your submental nodes. All right, great. So the last lymph nodes I have to assess are going to be your supraclavicular nodes. I'm just going to have you shrug your shoulders up for me. So palpate in here, okay? All right, great job. And then you can relax your shoulders. In a regular exam, I would also palpate your inguinal nodes, but for the purpose of this exam, we are not going to do that, okay? Any questions so far?
Nope.
All right, so now I'm going to move on to your back, and I'm just going to do, again, inspecting, listening, kind of palpating, and doing several different tests. I'll let you know what I'm doing as I go.
Okay.
All right, so the first thing I'm going to do is what's called a vocal fremitus test. So what I'm going to do is be placing my hand on your back in several different spots. And every time I do that, I want you to say the words 99, okay?
Okay.
All right, here we go.
99, 99, 99, 99, 99, 99.
All right, great job. Here. All right. Next thing I'm going to do is percuss. So I'm going to be placing my finger on different parts of your back, and I'm literally going to be tapping it and listening for sounds, okay? So you don't have to do anything special. All right, any pain with that?
Nope.
All right, so next thing I'm going to do, I'm just checking to see how your diaphragm expands and make sure it expands equally. So I'm going to place my hands on your back like so. So I'm going to take a deep breath in. All right, and exhale. Great, everything looks equal. The last thing I have to do back here is just take a quick listen to your lungs. So every time I place my stethoscope down, I want you to take a deep breath in and then exhale.
Okay.
All right. In. All right, out. In. Your armpit here. All right, great job. All right, I'm gonna move on to the front of your chest now. I'm doing kind of similar things here. I'm gonna listen and do the fremitus test and move on from there, okay?
Okay.
All right.
99, 99, 99, 99, 99, 99.
All right, great job. Now I'm just gonna take a quick listen to your lungs. So same thing, when I place my stethoscope, take a deep breath in and exhale as I move along to each spot, okay?
Okay.
All right. All right, great job. Now I'm going to be listening again, but I'm listening to your heart sound, so you don't have to do anything in particular, just sit there. And I'm going to be listening to 4 different spots, but I'm going to be listening to those spots twice because I have to use both the bell and the diaphragm of my stethoscope, okay?
Okay.
All right. Yeah. You all right? Yep, just breathe normally. Harmonic. Tricuspid. And mitral. All right, I'm gonna do the same thing again with the other side of my stethoscope, all right? Atrial. Pulmonic. Tricuspid. And mitral. All right, great job. So now I'm gonna have you lay down on your back, and I'm going to listen to those heart sounds again, and then I'm also going to be taking a feel for your neck arteries, okay, and your veins. All right, same thing, I'm going to be listening twice. Atrial. Pulmonic. Tricuspid. mitral. All right, flipping my stethoscope. Atrial. Pulmonic. Tricuspid. And mitral. All right, so now I'm just going to take a feel for the veins in your neck, okay? So I'm going to have you turn your neck to the right. I want you to hold your breath for me. Okay. I'm going to turn your head to the left now. Same thing, take a deep breath for me. Hold it. All right, great. Veins look good. Now I'm going to move on to your abdominal assessment while you're laying down, okay? Somebody listening, doing some palpating, and obviously some inspection. So umbilicus looks midline. Your abdomen is not round. So I'm going to take a listen quick. Just do normal breathing for me, okay? And take a listen to the aorta that runs through your abdomen, okay? And for the purpose of this exam, I will not be listening to your renal arteries today, all right?
Cool.
But on one of your follow-ups, we may do that. So next thing I'm going to do is some percussion. So similar to what I was doing on your back, I'm just going to be tapping in different spots, okay? Listening for different sounds. Sorry if that tickles, all right? Speaking of being ticklish, are you ticklish?
No.
All right, so I'm doing some light and deep palpation. So I'm going to kind of touching your abdomen lightly, just feeling for like upper abnormalities, and then I'm going to be doing deep palpation to really see if I can feel anything that's deeper below your surface, okay?
Okay.
Here's some light palpation. Let me know if it hurts or if you become ticklish, because we can do something different. All right, now I'm going to do deep palpation, okay?
Mm-hmm.
Sorry, is that ticklish or just uncomfortable?
Oh, this is funny.
Okay. And the last thing I'm going to feel for is your liver. So if you kind of take a deep breath for me. Kind of feel under there. Yep, there it is. All right, great. So the abdominal assessment is done. The last thing we have to move on to is your neuromuscular assessment. So I am going to have you just sit up for me. All right. So we're going to be doing some like resistance movements with different parts of your body, okay? So for this first one, I'm going to put my hand on your head. I just want you to push forward against it. All right, great. Push against it. All right, that way too. All right, great job. So now I want you to raise your arms above your head, like so. Bring them back down. All right, great. Now I want you to bring your arms up. Just hold them right here, and then I'm going to try to push down, but don't let me push them, okay? Push, 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 push. All right, good job. Bring your arms down. I want you to bring your arms kind of to your chest like so, and I'm going to try to pull them away, but don't let me. Pull, 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 pull. All right, good job. Now I want you to push my hands, push against my resistance. All right, good job. Now splay your hands out like so, and I'm going to try to squeeze your fingers shut, but don't let me. All right? All right, good job. Next, we're going to move on to your legs, okay? So I'm going to have you raise your left leg up. I'm going to try to push it down, but don't let me. All right, same thing with your right leg. Awesome. Now put both legs up. We're going to do the same thing. Just don't let me push. All right. Now with your legs dangling, I'm going to try to pull your legs out towards me, but don't let me. All right, good job. While I'm down here, I'm going to do, you can relax your legs for me. I'm gonna have you do what we call the gas pedal test. So I'm just gonna have you push down on my hands like you're pushing the gas pedal, and I'm gonna try to resist you, okay? All right, here we go. Awesome, great job. So while I'm down here, I'm also just gonna assess the pulses in your feet, okay? So you can just kind of relax your feet. There we go. Pedal pulses are great. I'm just gonna check your popliteal pulses behind your knees. All right, and now just hold your wrists out, and I'm gonna check your radial pulses. All right, pulses in all of those areas sound nice and strong. I'm just gonna grab some hand sanitizer. All right, so the next thing I'm gonna do is a tuning fork test. So we used this earlier for hearing, but now we're just gonna do it for some general sensation. So I'm gonna have your eyes closed for this test, and keep them open for now. I'm gonna tap my tuning fork, and I'm gonna place it on each of your extremities, or like each of your arms and your legs, and I want you to tell me if you feel it, and when you stop feeling it, okay? So if you close your eyes for me.
Feel it.
Okay.
Stop.
All right. Moving on.
I feel it. I stopped.
All right, now I'm gonna do this on your feet, okay?
I feel it. It stopped.
All right, last one.
I feel it. It stopped.
All right, great job. You can open your eyes for a minute here. The next thing I'm going to do is what we like to call a sharp or dull or sensation test. And I'm going to be doing this on both your arms, or all of your arms, your legs, and then also your face as well. So your eyes are going to be closed for this test. Whenever I tap you, I want you to tell me if it feels sharp or if it feels dull, okay? So you can take a feel if you want, sharp and dull, all right? I'm gonna start with your head, okay?
Okay.
All right, close your eyes.
Sharp. Dull. Dull. Sharp. Dull.
All right, so I'm gonna move down your arms, okay?
Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp.
All right, great job. So we are done with that part of the test. Now I'm going to move on and check your reflexes. So my reflex hammer here, I'm just going to have you for your tricep test. You're gonna have one arm hanging out at a time. I'm gonna tap your elbow, okay? I'm just seeing if there's a reflex in there. All right, you can relax that arm down. We're gonna move on here. All right, great. Now I'm gonna do your biceps. So for this one, your arm's just gonna be out like this, and we're going to tap kind of in that hip area. I'm just gonna see if there's a contraction in your bicep or that upper arm, okay? So just relax your arm here. All right. All right, great job. So you can relax your arms. The last one I'm gonna do with your legs dangling is just the knee or patellar reflex test, okay? So I'm gonna tap your knee and I'm just gonna see if there's a knee jerk. All right. All right, great job. All right, so now I can have you stand. I'm just gonna have you walk in front of me a few steps here.
Normal?
Yep, I'm just assessing your gait. All right, come back towards me. Great. Gait looks nice and steady. And now I'm gonna have you walk back in that same direction, but on your toes. All right, now switch to your heels. All right, great job. The cleaning people need to get in here and clean, don't they? All right, I'm just gonna have you face that direction. I'm gonna take a look at your spine here. All right. Looks great. All right, you can turn and face me again. I'm just gonna have you stick your arms out in front of you. Make sure your feet are nice and close together and close your eyes and just stand there. All right, great. Didn't see any sway, so you can open your eyes, put your arms back down and come towards me. I'm gonna have you face that direction now. Face that direction.
Oh, that one?
Yes, sorry. And then I'm just gonna have you kind of bend forward like you're touching your toes, just so I can kind of see your spine here. Make sure it's nice, straight curvature. All right, you can come back up. Great job. And now I'm gonna have you sit one last time. We're just gonna do a few quick tests here. I'm gonna do a rapid alternating test. I'm just gonna have you flip your hands back and forth like you're emptying a bunch of soup cans, okay? All right, great job. And the very last thing you have to do, we call it the heel to shin test. I'm gonna have you take your right heel and put it on your left knee and then just drag it down your shin, okay? Great job. Now do the same thing, left foot on your right knee and drag it down your shin. All right, great job. Well, everything looked nice and normal. Do you have any questions for me?
Nope.
All right, we'll get your paperwork all set up and we'll get you checked out.
Thanks.